Hey, what's up, what's up, what's up? Excuse me. I hope everyone is doing well. This video, we're going to be talking about EDS, the unique zebra, also known as Ehlers-Danlos Syndrome. A lot of people don't know what it is, and I'll go off the statistics in a minute, but I think 1 in every 5,000 people have the more common form of it. I will be sharing links and everything in the description so you can go and look at the knowledge and for yourself and maybe look at some other things. This is going to be like a basic overview, okay? It's too much to get too deep. But I have EDS, so I do speak on it in other videos, but we'll get more into that in a second. Okay, what is EDS? EDS is a group of 13 heritable connective tissue disorders. It's caused by genetic changes that affect the connective tissue. Each one of the 13 has its own little weird quirks and stuff like that. Some of the features I've seen across all types of EDS, including joint hypermobility, skin hyperextensibility, and tissue fragility. Tissue fragility, easy bruise, easy to, the skin is very thin. If you look at my skin, you can see right through it. It's kind of weird, but it's very, very thin skin. Also, the elasticity. This is what we're talking about. Some people it's a lot more, but that's why I'm, into taking care of myself. You can eat right to keep it from getting too much. Some EDSers, we call EDSers or zebras, have premature aging due to the connective tissue issues. Okay. Joint hypermobility includes subluxations, dislocations, sprains, and other injuries. Happens a lot easier. Like I can go to sleep and wake up and my arm is dislocated, and that's happened to me I don't know how many times. You kind of get used to it, and I do have things like a shoulder guard or whatever. It's very uncomfortable to wear, but there are some things that you can use to help with placement, along with pillows and stuff like that. We'll get into that on another day. How I care for my Ehlers-Danlos. Okay. Now the hyperextensibility is what I just said. Um, it's unusual skin texture, skin fragility, very thin skin, delayed wound healing, which is important if you have to have surgery or something like that. You got to let your doctors know you have EDS, or if you think you do, we'll go over, the basic tests that they do for you in office before the testing, the diagnosis process in a moment. And abnormal scarring. Not everyone, not everyone with a type of EDS has these characteristics. It's not everyone, okay? Tissue fragility, that means that the body's organs and other structures are more vulnerable to damage. Presenting as easy bruising, poor wound healing, severe fragility of skin, blood vessels, abdominal organs, eyes, gums, and bones. So when we're talking about Ehlers-Danlos syndromes, um, it's like a whole body health thing. It's very intricate. It's it's a lot. It's a lot. But once you understand, if you're looking for a diagnosis, once you understand that it doesn't have to rule your life and you can work with your body, yeah, you're gonna have bad days and stuff like that. That's gonna be a given, but you can learn to flow through those bad days a lot easier. Okay. Okay. So what causes EDS? Each type is caused by different variants specific to the genes that you've been given. Okay. Some are associated with multiple different genes, but the generic causes have not been identified. We just know it's a genetic, um, heritable disease. Okay, which means you can pass it on to your children. Okay, yo, it's late and my brain doesn't function well, at night. So this is please bear with me. Okay, now for those that would like to know, what is connective tissue and collagen? Like, what are those? Okay, so connective tissue is found throughout the entire body. The best thing, okay, all right. Let me just read from this little paragraph because I'm going to link this. I'm reading from the Ehlers-Danlos Society webpage. I'm not going to go read all of it, but I'm going to be, giving you more information in the description. So what are the connective tissue and collagen? There are different types of collagens with different functions. The Ehlers-Danlos syndromes are caused by changes in the genes that affect the structure and function of collagen and related connective tissue proteins. Connective tissue is found throughout the body. It provides support, protection, and structure to other parts of the body. Connective tissue disorders are caused by issues that prevent connective tissue from from functioning properly. So your connective tissue, that those would be your joints, the membrane that holds all of your innards together. If you've ever butchered an animal or cleaned an animal, you can kind of guess what I'm talking about. When you peel the skin back, you can see the connective tissue. Okay, that's within all beings. We have some kind of within all mammals. I'm sure. I know in all mammals. I don't know. I know fish has connected, like, because you can get some. Now I want some fish soup. Let me get off top. Let me stop. Okay. But for me, my joints are, it's like affects all of my joints. And then if I injure said joint, it doesn't quite heal back the way it needs to heal back. It doesn't snap back like it would for like a regular person without the condition. Okay. As I said earlier, this condition is a inherited condition. It can be passed down through your children, of course, if you want to procreate, but it can remain dormant or recessive. So dormant meaning, am I saying, yeah, recessive? Okay. Dominant or recessive. All right. So apparently I got the lottery with the dominant. Okay. So dominant. But yeah, it can be passed down. It can be definitely passed down. So let's see. I'll go over how EDS is diagnosed later on in this video, okay? Because I would like to talk more about the different varieties of EDS. There's 13. Yeah, 13. When I first learned about it in my early 20s, I believe there was only 8. And so I definitely, the DNA testing and all, the science is getting better. Okay, so how is EDS managed? There are no specific treatments because it can affect everything. Like I said, it can affect your eyes, your skin. It can cause you to have headaches, severe fatigue. I've done a couple videos on fatigue. And this is why I'm big on the spoon theory. I've done a couple videos on that as well. I'll link those in the description if you would like to know about those. And those are short videos. Okay, so let me tell you, just like any other disease, it doesn't affect the same person the same way. Like, even if you have diabetes, you're still a whole different person. So it's not going to affect you the same way it would affect someone else. Yes, the A1C, blah, 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 will go up. That's general thing. But as far as you personally, it might not, go whatever. Okay, so I'm getting to, if I have someone standing next to me that has EDS, the same form I have, we might not share any of the same symptoms. So that's how variable EDS is. Okay, we're talking about connective tissue throughout your body, collagen. I did a cooking video on chicken bones and collagen. Okay, like I talk about these things all the time because I know about these things. So definitely work with your care team or find a doctor and ask questions. You can always go online, and Google. I'll put some links in, I'll put a whole bunch of information, guys. Don't worry if you have questions, okay? It won't be just from one point of view, all right? I have the disorder as well. So I would like to educate you so that you can follow the links to, doctors that have written about it and have studied it. But as far as living through it, hey, it's a whole different experience, all right? You know your body the best, better than anyone else. I'm telling you right now, that is true, and you know it to be true. Okay, so the diagnostic process. And this is where I'm going to show you guys a little bit. I used to do tricks when I was a child, like jump rope with my arms. I don't even know what the fuck I was thinking. Okay, like besides, all right. So first you gotta go to a doctor, right? You let them know that, all right, so some of the general symptoms of EDS is joint hypermobility, pain, and fatigue. Okay. There's so many different comorbidities that can affect your EDS. So, what I'm going to show you is actually on the paper that they're going to have you do in the office. Um, okay. So, my hands, you see, I can bend them all the way back. And I'm in my 40s. I haven't been doing it for years, but I can, if I practice, and I'll legit tell you, if I practice stretching, I can get them to touch the top of my hand. You know, that's, you touch your thumb to, hold on, I can do it better with this. The skin thing. I can hyperextend all my joints. If you can stand up and lock your knees and not pass out, that's a really good indicator is if you might have the disorder. Coming from a veteran where I've had to stand in formation and I didn't know what locking knees was. I was just standing regular and I never passed out. Like I passed out in heat before because it was too hot. Literally, ooh, they were talking too freaking long out there, son. I can still feel the sweat coming down my body. Them BDUs. But okay, so they'll make you do a whole bunch of tests, and then what you want to do is follow up and ask them to send you to get a genetic test because you need to know what form you have. There are some forms that are very dangerous, very dangerous. Um, I'm gonna try to keep this video short, like less than 20 minutes. But for instance, I had to have brain surgery, and I was clinically diagnosed with EDS with the paperwork, but they needed to know what kind of EDS I had because I had they were going to be working on veins and stuff. Oh, that's my water heater. I was about to like. Anyways, they had to test. They had to do the genetic testing and to see which form, and they were not going to do the surgery if I had um, the vascular form of EDS. I'm gonna have to probably come back tomorrow morning because I am freaking and finish up with some more of this information because I think I'll just keep the video under 25 minutes. That'll be good, and then y'all can just speed it up or whatever. But yeah, they wouldn't perform it if I had vascular. I would not have survived. So yeah, it's very important if you suspect you have something. It's not normal to be in pain. That's not normal. Pay attention to your body. Listen to your body. Write your symptoms down. And I know I'm like writing, but we don't use, oh, I still use pen and paper, but many people just put it down in your notes, if a new symptom arises, and then make a decision whether you want to go see the doctor or not. And also do some research, and that's why I'm going to be putting some articles in there in the description. I like to put peer reviewed, so don't if you're not into peer reviewed, I'll put some basic articles. One is from the website, the Ehlers-Danlos Society. So when I first found out about my condition, I did a few online groups, and they were very helpful and set me on the path to where I'm at now, and where I can manage my form of EDS. Okay, everyone, I'll talk to you later. So it's been almost 2 days. Sometimes it's like that. But I wanted to pick up just a little bit and speak really quickly on the other, because there's 13 forms. I have the most common form, okay? The most common form. Thank goodness. There are only a couple of them where they're more common than others. The rest are like 1 in 1 million. Very, very rare. And so mine is called Hypermobile EDS. And it happens in about 1 in 3,100 to 5,000. The inheritance gene is a dominant, and it's a generalized joint hypermobility, joint instability, chronic pain. Okay, the next one is classical EDS. It happens 1 in 20,000 to 40,000. And it has a whole bunch of other stuff on here that I do not understand, but the inheritance pattern is also dominant. And the distinguishing features of that is skin fragility with extensive atrophic scarring, very stretchy skin with velvety or doughy texture. And then this is the one I was afraid to have, so that I could have brain surgery. And I'm glad I don't have this one. This is vascular. I'm going in order. Okay. That hurt to bend my neck like that. Anyways, it happens 1 in 100,000 to 200,000. It has a whole bunch of little protein information I don't know anything about. And then it's also a dominant pattern. And the distinguishing features are arterial fragility with aneurysm, which is what happened to me. Dissection, rupture. Oh my God, they were digging all up in my brain for all this stuff. Organ fragility and rupture.
pneumothorax. So that's the vascular one. That's the one I was like, that's dangerous. I would not have been able to get surgery on the brain tumor, the type of brain tumor I had, because it was a vascular brain tumor. It was made of like veins and artery. It was all twisted up. My artery had cut off the main artery down, like, bro. Okay, so then we go into the 1 in 1 millions. I'm not gonna speak too much on the distinguishing features or the inheritance pattern. I'll just say the names as best as I can, and I hope you get a kick out of that. Okay, so we got periodontal EDS. I know that because dentist. All right, kyphoscoliotic EDS. I'm gonna have all this for you guys. Don't worry about it. Okay, now we got spondylodysplastic EDS. Don't ask me to say all of it all together like it's supposed to. Okay, I know how to say this one. Brittle cornea syndrome. I mean, like, right? And then the next one is arthrochalasia EDS. Okay. And then we got musculocontractural EDS. Oh my gosh, I just looked at one of the distinguishing features for that one. Oof, you guys are gonna have to look into this. Read what I'm putting up. Okay. And then you have classical like EDS. And then we got dermatosparaxis EDS. And then we got myopathic EDS. We have cardiac valvular EDS. Okay. So yeah. There are it's Ehlers-Danlos syndromes is nothing to really play with. When you go look for your diagnosis, make sure that that you do get a genetic test done. That way you know exactly what you have, and then you can maneuver, and you can, if you're listening to this far, you're obviously, are trying to inform yourself on medically, just, information out there, whatever. But definitely there's assistance out there if you're having a lot of dislocations and you don't know why. Like if you're having easy bruising, like there's so many things. If you have that question, it's just a little poke. That's it. All right. And then you can move forward and plan your life accordingly and live a better quality of life, right? I mean, no matter how many days we're going to be here, let's try to make them at the best quality that we can, right? So I hope this information helps. You can put your thoughts and any information you find, your feelings, whatever you want to say or whatever, down in the comments. You can like and share. I really appreciate you guys coming through and learning a little bit basics about EDS. All right, y'all. Peace, love, and light.